is also to know the expectation of the patients and tell them, okay, this is possible, this is not possible. The other thing that is also important is that I want to find out from Maya if she has a child before, because that also affects the outcome. She have a child before now, so because some people would desire what we call a bud-like abdomen, and which is not possible for someone who has delivered. However, I've seen one or two who had maybe a child before approaching us, and we did their body, and they have a bud-like abdomen because the muscle, there's a muscle here which everybody knows, and they call the six-pack or the eight-pack, whosoever we call it rectus abdominis. You can see the demarcation on both sides. So during childbirth, they normally will go apart. But in our own case, since there's no childbirth, definitely the result will be good. So the other thing we'll basically do, she is just a demonstration. So I'm just going to do a mini demonstration. So this is a surgical marker. When we want to do the marking, she's supposed to put off her bra, her trouser, and pants, because we have to demonstrate the how high or the side of the butt, the hip side, that everybody will call it. Now we identify the areas. Like in my own case, these are areas I pay a lot of attention to, because I want this to go in all the way inside, so that the butt come out from here, just something from this side. So I have to pay a lot of attention. So when I want to do it, I'll mark this area out. There are different ways of doing this. Sorry, it's a little so sorry about that. So I'll mark specific areas. These are areas I'm going to mark. This is my marker, it's not really working. So I have like lines in different, I sample some areas. Sometimes I use star just to show me where I'll pay more attention to. So the other thing I do is I go to the back. For a lot of ladies, looking at her butt and the camera view, I call this an A-type butt. It's A, because if you look at it, the lower butt is wider, the upper butt is lower. So this is an A-type butt. And every lady wants the apple butt, which is the hip side. They want the hip side to be well demarcated. Now, the other thing about this butt is that there's no clear demarcation between her back and the butt. Yes, she's a woman, she has butt. Everybody will like this kind of butt. However, there's no 3D demarcation, because when I say 3D, meaning that this side will be so separate and this butt will come out differently. The waist will go all the way down. That's basically, and we do our liposuction from all the way, but it's not everybody that will have fat all the way to their shoulder blade area. So we make like a small hole somewhere here, another hole somewhere here, and another one. We basically use 3. When I started, it was more than that, but I realized for the black skin, they tend to have a lot of scar. So basically, I put one here, then one in the cleft here, so that all the scars of the holes will just, in front I'll put only 2. It can be hidden by your pants. So then we'll take out all the fat. So all the fat in this area will have to go. So you have a very small waist, a very nice hip, the same thing. Now this is the side that is usually more difficult for anybody to get. So it takes sometimes 2 sessions of fat grafting to get that kind of hip. But definitely the waist always come out really nice. For some also, they request for their arm. You can see the fat in this area. They request for it to be taken out. So we make a small hole here. The hole is about 4 millimeters. We use it in taking the fat out. So the fat will be transferred here. We'll make a small incision there also below the butt to transfer the fat. We'll focus more on the side, but that's where a lot of people want fat to be transferred to. Then I'm sure she will look nice after the procedure.